Did you know that an itch in certain spots, one that you can't explain, could be a quiet warning from your body about cancer? Most people just ignore a little itch here and there. But for older adults, especially those over 60, an itch could be an important signal from your body. It's a signal you really shouldn't ignore. In this video, we're going to talk about 5 very specific itchy places on your body that could be a sign of cancer. These are not just random itches. Doctors have seen these patterns many times in patients who were later diagnosed with serious cancers, like lymphoma, pancreatic cancer, and even breast or skin cancer. Please watch until the end, because we're not just listing body parts. You'll learn the real reason behind each type of itch. You'll know what to look for, what questions to ask your doctor, and what to do if any of these signs seem familiar to you. Most importantly, this video is not about causing panic. It's about paying attention to your body. Because the earlier you notice these quiet signs, the better your chance of catching something before it gets harder to treat. Let's begin. Sign number 1, an itch on your lower legs that won't go away. When older adults get an itch on their lower legs that lasts, especially on the shins and calves, it's easy to think it's just aging skin or dry skin. But this very specific kind of itch has often appeared in people who were later diagnosed with blood-related cancers, especially lymphoma. This isn't an itch that comes and goes. It stays. It often feels worse at night, and unlike dry skin, lotion doesn't make it better. Why does this happen? It can be because cancers like Hodgkin's lymphoma affect your immune system. These cancers start in the lymphatic system. The lymphatic system is a key part of your body's defense and how it drains fluids. As the cancer cells grow, they release chemicals into your blood that cause swelling and irritation, inflammation. A common side effect of these chemicals is a deep, almost burning itch that often settles in the lower legs. Even if your skin looks completely normal on the outside, the nerves underneath can be irritated from what's happening inside your body. Let me tell you about a man named George, who was 75 years old. He shared his story at a cancer awareness event. He said that for almost 6 months, his only symptom was an itch on the front of his legs that he couldn't control. At first, his doctor thought it was eczema, or maybe a reaction to laundry detergent. But then, blood tests showed his white blood cell counts were not normal. More scans found swollen lymph nodes in his chest. Then, the diagnosis became clear. George said the itch came first, long before anything else. Stories like George's are not rare. Now, not every itchy leg means cancer. But here's a key difference. Pay attention if the itch doesn't get better with treatments you'd use for dry skin. If there's no rash, you haven't used new soap, and there are no bug bites, but the itch has been going on for weeks, it's time to look deeper. This is especially true if you also have other quiet signs, like sweating a lot at night sweats, feeling very tired, fatigue, or losing weight without trying. For older adults, being aware of this is especially important. As we age, our body's warning signs can become less obvious. Pain might not show up right away. Lumps might be too deep to feel, but your nerves can still react to what's happening. A deep, restless itch that just won't go away is often how this reaction first appears. If you, or someone you care about, has been scratching their legs every night, trying creams without any relief, and wondering why nothing is working, please don't ignore it. Talk to a doctor. Ask about getting blood tests. Tell them about the pattern of the itching. Sometimes the body whispers long before it shouts. Listening to those whispers can make all the difference. Sign number 2, itching deep in your upper back, often between the shoulder blades. There's a specific kind of itch that can show up deep in the upper back, right between the shoulder blades. It's often ignored, or people blame it on bad posture, dry air, or even an old shirt tag. But for many older adults, an itch in this exact area that doesn't go away, especially when it feels like it's coming from under the skin, has been linked to pancreatic cancer. And the strange thing is, this itch often appears months before any clear pain or digestive problems start. This connection between an internal organ like the pancreas and an itch high up on the back might seem odd at first. But here's how it can work. When tumors in the pancreas start to grow, they can block the bile ducts. These are small tubes that help drain bile, a digestive fluid, from your liver into your intestines. When this drainage slows down or stops, bile salts, substances in bile, start to build up in your bloodstream. And one of the first things these extra bile salts do is irritate nerve endings. This often happens in areas like the back, where the body has many sensory nerves. I remember a woman named Linda, who was 70 years old. She told me she had what she called a phantom itch on her upper back. She would wake up scratching it every night. Nothing helped. Not lotions, not back scratchers, not even changing her mattress. She said it felt like the itch was coming from the inside. She went for blood tests because she was feeling very tired for other reasons. Her liver enzyme levels came back high. This led to more scans. Eventually, doctors found a small tumor in her pancreas that was pressing on her bile duct. The scary part was that the itch was her only real symptom. She had no pain, no yellowing of the skin, just a deep, nagging feeling she couldn't get rid of. And the only reason she caught it early was because she spoke up, even when it felt like just a small complaint. This is why itching in that specific area of the back matters. A general back itch can come from dry skin, pressure from sitting, or rubbing from clothes. But if the itch is focused in one spot, won't go away, and doesn't get better with skin treatments, it could be a deeper sign of something happening inside your body. Pay close attention if you also notice darker urine, pale-colored stools, or unusual tiredness. The back can become the messenger, even when the problem is actually in your gut. For older adults, these kinds of quiet symptoms are easy to ignore. We don't always want to sound dramatic, but your body is often wiser than you think. And when your body sends you the same signal again and again, it's worth listening, even if it's just an itch. If you're still watching this video and finding these insights valuable, please comment 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the notification bell so you don't miss any new videos. Your support helps us continue creating good content to inform and inspire you. Now let's move on to the next sign. Sign number 3. An itchy scalp, but with no visible flakes or dandruff. An itchy scalp might not sound like a big deal. In fact, for many older adults, it's easy to blame it on dry air, aging skin, or a shampoo that doesn't quite agree with them. But when the itching on your scalp becomes persistent, meaning it doesn't stop, especially when there's no dandruff, redness, or flaking, it can sometimes be an early sign of something deeper happening beneath the surface. This could include blood-related cancers like leukemia or skin cancers affecting the scalp. What makes this kind of scalp itch different? It often feels more like a tingling, crawling, or burning sensation, rather than just dryness. It may move around from one spot to another, and it often doesn't get better with typical treatments like anti-dandruff shampoos or moisturizing scalp oils. For people over 60, these kinds of feelings can point to nerve irritation. This can be triggered by an unusual immune system activity, which can happen when leukemia cells begin to multiply in the blood. This, in turn, affects how the body controls inflammation, swelling, and irritation. There was a man named Henry, 73 years old, who mentioned that his scalp had started itching every afternoon. He tried changing hair products. Then he thought maybe his hat was causing the problem. But even after switching shampoos and going without a hat, the itch remained. Later, he had a full blood test because he was feeling very tired for other reasons. Doctors found his white blood cell counts were abnormally high. A bone marrow biopsy, a test of the soft tissue inside bones, confirmed he had early-stage chronic lymphocytic leukemia. His itchy scalp had been the first and only part of his body alerting him to a problem. What makes this especially important is that many older adults already experience some level of dryness or skin sensitivity. So when something like an itchy scalp starts to feel like just another normal thing, it often gets ignored. But what makes a cancer-related itch different is how resistant it is. No cream helps, no product soothes it. It lingers, it nags, and it often feels like it's coming from deeper than just the surface of the skin. And while leukemia isn't the only concern, skin cancers that develop on the scalp can also be a cause. This is especially true in areas where hair is thinning. These skin cancers can begin as nothing more than a small, itchy patch. Sometimes it looks like dry skin or a small bump, but if it keeps itching, especially in the same place, and doesn't go away, it should be looked at closely by a dermatologist, a skin doctor. Because the scalp isn't always easy for you to examine on your own, it's helpful to ask a spouse, caregiver, or even your hairdresser to check the area regularly. If you feel an itch on your scalp that hasn't gotten better in weeks, and it's not responding to anything you try, that's your body's signal to look into it a little deeper. This is especially true if you've also been feeling more tired than usual, bruising more easily than before, or just feeling off in a way you can't quite explain. It might feel like a small thing, but sometimes it's the small, stubborn things that tell the biggest story. Sign number 4. Itching in one specific spot on your chest or breast area. When older adults, and this includes women and men, notice a persistent itch on their chest or breast area, it can be easy to blame it on something simple. This is particularly true for an itch around the nipple or just beneath the breast. People might think it's from sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something much more serious. This could be inflammatory breast cancer or other tumors growing near the chest wall. What makes this sign unique is that the itch often shows up before any lump does. The skin in the area might feel warm, irritated, or tight. Sometimes there's a change in the skin's texture. It might feel slightly rough, thicker than normal, or have a reddish tint. But just as often, there's nothing to see on the surface. There's only a deep, persistent itch that never seems to go away, no matter what cream or lotion is applied. I recall the story of Ruth, who was 69. She noticed an odd itching sensation around her right breast. She tried switching bras. She tried different laundry detergents. She even went without wearing a bra for a while, thinking the itch was from friction or rubbing. But the itching continued in the same spot every day. When she finally went in for a checkup, her doctor noted some slight skin dimpling, like little dents in the skin, and ordered more tests. What they found was a small but aggressive tumor. It was growing close to the skin surface, but it wasn't the typical round lump most people expect with breast cancer. This is one of the reasons inflammatory breast cancer can be so dangerous. It doesn't always follow the usual rules of cancer. It can look like a simple skin rash. It can spread quickly. And often, the earliest symptom is not pain, but irritation or itching. That's why paying attention to an itch in the breast or chest area is so important, especially if it doesn't move around. It doesn't get better with moisturizers, and it stays in the same place day after day. For men, this kind of sign can be even easier to miss. Male breast cancer is rare, but it does happen. It often goes undetected because the signs don't match what most men think to look for. An itchy patch near the nipple, a small area of thickened skin, or a persistent ache or discomfort under the chest muscle might not sound dramatic. But for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more to consider. This kind of itch isn't always about cancer growing in the breast tissue itself. It can also be caused by enlarged lymph nodes, small glands, under the arms, or just below the collarbone. This could be a sign of lymphoma or another cancer nearby. So, if the itch in this area comes with any swelling, warmth, or even just a vague feeling of heaviness, don't wait. See a doctor. Early detection of cancer doesn't start with fancy machines. It starts with awareness, with listening to your body, with noticing the quiet patterns that seem out of place. Your skin can't speak with words, but it can send signals. And this kind of itch is one of the most important signals not to ignore. If you're still watching this video and finding these insights valuable, please comment 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the notification bell so you don't miss any new videos. Your support helps us continue creating good content to inform and inspire you. Now let's move on to our final sign. Sign number 5, persistent itching in your anal, bottom, or genital area. There are few things more uncomfortable and more often ignored than itching in the anal or genital region. It's an awkward subject, especially for older adults. Many people would rather just brush it off than bring it up with someone. But when this type of itching becomes chronic, meaning it lasts for a long time, and there's no obvious cause like hygiene issues, an infection, or irritation from incontinence pads, it may be your body trying to draw your attention to something much more serious. In some cases, a persistent itch in this area can be a quiet early symptom of anal cancer, vulvar cancer in women, or even penile cancer in men. What makes this kind of itch dangerous is that it often disguises itself as something minor. People might assume it's just dry skin, a reaction to toilet paper, a bit of irritation from walking, or even a side effect of incontinence pads. And in many cases, it is one of those things. But if the itch lingers for weeks or months, if it keeps coming back no matter how much you clean, treat, or moisturize the area, and especially if it begins to feel more raw or burning rather than just a surface itch, it deserves a closer look. There was a man named Eugene, 76 years old. He had been dealing with what he thought was irritation from hemorrhoids for almost a year. He used creams, changed his diet, and even tried cold compresses, cold packs. But the itching never fully went away. Eventually, a colorectal specialist, a doctor for the colon and rectum, did a scope exam. They found a small sore or lesion on the wall of his anal canal. It turned out to be an early-stage tumor. It would have continued growing silently if he hadn't followed his gut instinct. That feeling that something just didn't feel right. The same holds true for women. Vulvar cancer is relatively rare, but it becomes more common after age 60. And one of its earliest signs can be a recurring itch on or near the outer genital area. There may not be a lump, but the skin might begin to feel rougher, look slightly discolored, or seem thinner than usual. Many older women assume it's hormonal or related to postmenopausal dryness, and sometimes it is. But if the itching is relentless, it won't stop. If it gets worse at night, and if it doesn't respond to normal treatments, please don't dismiss it. This part of the body is full of nerve endings. It's highly sensitive. Because of that, it often signals internal changes before more visible symptoms show up. Whether it's a change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, a chronic, long-lasting itch in this region can be a red flag. This is especially true if the itch is only on one side or focused in one small spot. And yet most people hesitate to say anything. They might fear embarrassment, or they might worry they're overreacting. But being silent is far more dangerous than being curious about what your body is telling you. Speaking up about an itch might just lead to early detection, better outcomes, better results from treatment, and peace of mind. The most important takeaway here is, if an itch in this area doesn't go away, don't assume it's normal. Let a healthcare provider, your doctor or a nurse, take a look. Because catching something early, even something as serious as cancer, often starts with noticing something small, something subtle, and choosing not to ignore it. As we close out this video, I want to leave you with one simple truth. Your body is always communicating with you. Sometimes it speaks through pain. Other times it speaks through feeling very tired, fatigue. But often it begins with something so small, so subtle, that we overlook it, like a persistent itch that keeps returning to the same place. The 5 areas we talked about today, the lower legs, the upper back, the scalp, the chest, and the anal genital region, aren't just random spots. They are places where serious internal issues, including certain cancers, often begin to send their first quiet signals. And for older adults, learning to listen to those signals could mean the difference between catching something early and letting it silently grow. You don't need to live in fear. That's not the point of this video. The point is to empower you, to remind you that your instincts matter, and to understand that what seems like a small symptom may be your body asking for help. If any of these signs felt familiar to you, please don't brush them off. Bring them to your doctor's attention. Start a conversation. You deserve answers, and you deserve peace of mind. Thank you for joining us today. We'd love to hear from you. Please leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so please don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share it with others. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.